treatments next week, and then I'll be back in Florida, and most probably, his cancer, where we attacked it, will stop or shrink or go away, and we'll prove it to him, and we'll prove it to his families, and we'll talk to you about it. Also, we may well talk about treating his rectal primary. His rectal primary has never been treated, and you remember before it was an obstructing lesion, so there might be a reason to treat the rectal primary as well. Lots of things to do and lots of things to talk about with radiosurgery. We're going to hear from our sponsor, from a few new voices, and they'll be right back. If you have questions, please feel free to call us at the WOR studio. This is Dr. Lederman with the Radiosurgery Hour.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212 Choices, 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare and Medicaid accepted. Call Dr. Lederman at 212 Choices, 212 Choices for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212 Choices. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212 Choices.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212 Choices for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hi, welcome back. We hope you're all okay. I want to talk about a gentleman who, if he knew about this radio program, would have benefited greatly from this radio program and the information we provide. It's a 47-year-old man from England who's here in New York City, 47, and was having some symptoms. He was coughing up blood. He was found to have a lung cancer, and he was taken to surgery for removal of that lung cancer, which probably all sounds good for you, right? You have a cancer, you remove it. Well, there was a missing step, and the missing step was no staging. We talk about staging all the time. What is staging? It's to see where a cancer is before any action is taken. So if you have a staging, you have a roadmap. It's like going from here to there. If you don't have a map, you're not so likely to get there. And so this man had big operation on his lung, and he probably thought he was home free. And then a couple weeks later, 2 weeks later, he had seizures and was found that the cancer had already traveled to the brain. So again, they didn't stage him up. They just opened up the brain and took out the tumor. And wow. Then a couple weeks later, he got worse again, and they found two more tumors, and they were taken out. So in 1 month, he had 3 operations, opening up his chest and opening up his brain twice. And then, never recommended radiation. He got worse again the next month and had his 4th major operation in less than 3 months, and his 3rd time they opened up his head. Finally, his doctors sent him over to us. Finally, he has a chance to learn about other treatments for cancer besides surgery. Finally. So he came to us, and he has an incision over the top of his head from ear to ear. And that incision has been opened 3 times, almost like a zipper, except it's a human being there. And he suffered a lot. It's taken a lot of his vitality and strength away. Even for a 47-year-old, you can't subject someone repeatedly to endless treatment, especially if the treatment's not getting him where he needs to go, which is to have better control of his cancer. So he just had his 4th operation. He came to me finally for the first time, if you can believe it. He was at 2 big hospitals and seen multiple doctors. Finally, for the first time, we staged him up, and what did we find? More brain tumors and more spread of his lung cancer. So it's the first time. It was April, May, June, July. It's taken this long to get him staged up. Now, he is getting systemic treatment to try to stop the cancer cells from spreading in the bloodstream. We found a massive tumor in the adrenal gland. The adrenal gland produces hormones. It's located just above the kidney. Our success rate in treating adrenal cancers and adrenal metastasis is high. He has multiple brain tumors, and similarly our success in treating multiple brain tumors is high. So we offered him treatment, and the family and his loved ones wondered whether he should have any treatment or not, or just call it a day, going on a hospice. And at the end of time, after deliberation for a day or so, they decided they want to start his treatment, and he was seen this week. He was staged this week, and the family and friends decided to proceed with treatment, and actually had his 2nd treatment on Friday and is doing better. And I'm sure he's happy to have non-invasive treatment where you lay down, get a treatment, and a few minutes later get up, compared to 4 operations on his brain and lung that didn't buy him what he wanted, which was to be healthy and in good shape. So again, lessons here are: you may want to get a second opinion before you get cut open. You may want to get staged before you get cut open, and learn about all the treatment possibilities first. It sure could have saved this gentleman a lot of, literally, headaches and heartbreak. And similarly, another man that came, actually is a famous physician. He's a physician at one of the big medical schools in Manhattan, and he had colon cancer and was diagnosed 10 years ago. Has been on chemotherapy for much of those 10 years, and has just been getting chemo. He went to another famous chemo doctor who thought, as long as I'm in his hands, I'll do whatever he tells me. So he did that. So 2 famous doctors, one was a patient, one was a doctor, and he's had a lot of problems over the years. He had trouble speaking and breathing, and trouble with pain in his abdomen. This was a colon cancer that spread to the various sites, stage 4. And he finally came for a consultation. He really didn't believe radiosurgery was for him because his famous doctor never told him about it, so I thought it must not be for him. But he was suffering with this pain for years, and he was suffering with the difficulty breathing and speaking for years. So we offered treatment. We saw where the cancer was, and actually the 3 biggest areas. One was in the mesenteric root. It was colon cancer that had spread to the mesentery, which is part of the body that holds the intestines in place. There was a big mass there. There was a big mass in the airway on the right side, blocking the air and oxygen from getting in and out of his lungs. And there was a big tumor by the aortic arch, which was paralyzing his vocal cords. Now, we treated him last year to all 3 sites. He tolerated treatment well. He had no side effects. And best yet, after we treated the mesenteric root, the abdominal pain went away. After we treated the airway, his breathing got better. After we treated the aortic arch cancer, his speaking got better. He loves to sing and speak and tell stories and be active, and he was grateful that all 3 improved. Oh, it's almost a year later. Still's been getting chemo. Got him restaged, and guess what are the only 3 sites of tumors that are controlled in his whole body? Yeah, you got it. The mesenteric root, which we gave radiosurgery to, the airway, which we gave radiosurgery to, and the aortic arch by the recurrent laryngeal nerve, which we gave radiation to. He's grateful that we were able to improve his life. He now wants us to treat the next 3 biggest tumors, which we can do, even though, and especially because chemo just is not working. So he's had lots of chemo, yet where we've treated has been successfully treated even a year later with a better quality of life. And now we will treat 3 new tumors in his lung to try to help his breathing and his symptoms and his quality of life. So that's a gentleman who has metastatic colon cancer, spread stage 4. And one of the common questions I have is, Doc, I have stage 4 cancer. Can you help me? And the answer is very likely we can help you. But it's obviously best to come in, sit down, talk together, meet together, review the records together, examine the patient together, and then talk about all the options. And we're happy to talk about surgery, chemo, radiation, radiosurgery, all of them, because we are so proud of the work that we do. We were first in America with radiosurgery and have a very extensive experience, which is, I think, what a patient wants when they come for evaluation. They want to know that the doctor has a lot of experience. Our doctor is triple board certified in internal medicine, medical oncology, and radiation, which is very rare, but I think very useful for a patient with cancer to have extensive experience and extensive training and extensive board certification. So again, this is Dr. Lederman speaking about radiosurgery on the WR station. We're live if you have questions. Common questions that we get are, can you treat me? Well, we have to sit down and see. Where are you located? 1384 Broadway, 1384 Broadway, New York. It's Broadway and 38th Street, right between Macy's and Times Square on 38th Street. Very easy to get to. Close to Penn Station, Grand Central Station, Port Authority, most subways, trains, buses, PATH trains. So it's very easy to access us. And if you're in trouble, if you're in pain, if your treatment's not working, we promise to see you within 1 business day. Something called the Urgent Cancer Consultants. We'd rather work more than have you suffering. So if you have questions, call us, or best yet is to make an appointment. And we do have a booklet DVD to send to you if you wish. So we're going to hear from our sponsor, and then we'll be right back to take your calls, your questions, and talk more about how you can make your life and the life of your loved ones better.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within 1 business day, because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here.